Nobody wants to hear the word cancer.
It's devastating.
Fear of dying.
Oh, it was awful.
The biggest thing is the fear of the unknown. When you hear those 3 words, I have cancer, your whole life just completely stops. We were just scared to death, not knowing what was going to happen and not knowing what to expect when we went back to see him.
Everything was happening so fast. I was just trying to, keep a grip on what was occurring and trying to make the best decisions for me.
Even if you're feeling well all that month and there's nothing wrong, you still feel like, God, what if there's something wrong? And especially if you have a cold or you have a headache, it's like, do I have brain cancer?
Every time I go to MD Anderson, I am nervous. And Joanne is too, I believe, because the results could change.
Waiting in the lobby, it probably wasn't like a 3-hour wait, but it sure felt like it, just sitting there waiting to meet the surgeon.
Until you walk in the shoes of someone with cancer, you don't understand.
Hello, I'm Dr. Walter Bale. While we clinicians may work with cancer every day and find some aspects relatively routine, the experience of being diagnosed with cancer can be terrifying for patients. Both verbal and nonverbal communication are central to the quality of the patient's experience and can be useful in reducing patient anxiety, especially around the time of diagnosis and treatment. Knowing that their medical outcome is uncertain, it's important for patients to feel that their physician is not only technically competent, but also caring. In this video, you'll see actual patients and family members who talk about aspects of their relationship with their physicians, and in particular, how effective communication helped reduce their anxiety. They found that 5 strategies practiced by these clinicians were particularly helpful in allowing them to feel more comfortable and confident with their physician and their cancer treatment. Let's listen as these patients talk about these strategies.
Your best doctors, I believe, are the caring doctors. You can't be just a book doctor. You have to be a people doctor. And one of my criteria for MD Anderson was to make sure I get a doctor that was caring, that I could talk to. The doctor I had before, he's probably rated as one of the best technician surgeons in the country, but he had no bedside manners.
I feel like if the doctors are not interested in how you're feeling, then, it relates to your care. They may not, it may have this direct correlation to how, you respond to care.
Actually, at one point, I remember him holding my hand along with his assistant holding my hand and making you feel at ease because you have no clue. I had no clue what to expect going down there.
You don't have a lot of people where you can just go and just, say how you really feel. She knew about, what I had gone through, and then just my diagnosis, and it was just wonderful.
The best way to help a patient is to give them the results as soon as possible. Giving you that information that you've been wanting for so long and anxious about getting, that first couple of minutes just telling you everything's okay, making them wait longer for that is just increasing the tension and the stress to the patient. Don't just tell me, we'll call you if there's anything wrong, because you're going to be waiting for that phone call.
I can remember one morning one of the doctors coming in, and I was watching TV, and one of the ladies on ABC had just taken off her wig when she had just lost all her hair, and I was sitting there crying in my bed about losing my hair, and he came up and held my hand, and he told me again and again, he says, "You're not going to lose your hair." And that's compassion, because he saw that was truly something that bothered me. And he came up and held my hand and said, "No, that's not going to happen."
I think it would be very helpful to patients if a doctor can make them feel comfortable, which is really hard to do, especially under this circumstance where it's oncology and, everybody has a life-threatening disease.
He shook our hands, he introduced himself to both of us. He pulled up a chair, brought it across, and sat right next to us.
I felt very comfortable with him when he first came in and when we first spoke to him. Other doctors will ask us if we have any questions, but sometimes you feel like you're imposing on them, and you shouldn't as a patient or even as a member of the family.
It really helps when he says hi first, and it's like, how are you doing? And then starts with, everything was fine, hopefully, your results. And then if he wants to talk about personal stuff, that always helps. That makes you feel comfortable.
I just sensed that he was more open to us. Other doctors, you go in there, it's like, yeah, he'll answer your questions, but you feel like he's looking at his watch to see he has to be somewhere else or something.
When they stand on the door with the door open, that always feels like they're in a hurry. Closing the door behind them makes it feel like you're alone in a room. He's there with you and not just checking on you and rushing off, even if he does rush off.
The small talk actually helps a little bit, breaks the tension, especially the first time. I would try to look everybody in the eye, shake their hands, kind of put them at ease, but also give them the professional, said, I'm here to serve you.
I felt like, that they cared. You weren't a number, just somebody passing through for the next 6 months. They were really, seemed like they cared about their patients and being involved in what was going on with their patient.
First of all, he asked my wife her name. So he wanted not only to know me, but to know us. Not just cancer-related stuff, but how are you doing in general? How's your state of being?
Recently, I saw a doctor, and she asked me, she said, well, how are you doing mentally? And I needed to emote, I needed to express how I felt, and I was like, that is so great that she picked up on that, or maybe that's something that they do all the time, but it was something that I needed to hear, and I felt like that was wonderful.
Being comfortable enough to ask anything and everything any question you might have, that's always really important. Because if you don't feel comfortable asking about, bowel movements, sex life, anything that might come up, then that relationship is pretty much worthless, because you're not gonna tell them about the real problems you're experiencing, and he's not gonna know. He can help you, but if he doesn't know about it, it's not gonna help at all.
He made us feel at home in that if anything goes wrong, we have stuff to help you through it. You have to speak up and let us know what's happening and let us know what it is that's bothering you, because we have everything known to man, to help you get through this.
I remember being really, really scared when I got there, and just meeting him, interacting with him answering questions I had, it brought a peace of mind.
Just the assurance from our doctors that, you're going to experience some things, and it may or may not be cancer, and a lot of patients go through this. And hearing that, it helps a lot.
If the patient or the caregiver has a question about something that may seem very minute, it should be answered, but it should be answered in a level that's not demeaning.
Don't be flippant and say, I'm in a hurry, I don't have time to answer your questions.
That day was very busy. I could see from the waiting room, there was tons of people, so I knew he wasn't gonna have a lot of time. I thought he was gonna have a lot of time. He did. That first day, he spent a lot of time, analyzing my case, going over everything, explaining everything to me. He also told me that chemo and everything could possibly leave me sterile, and how important it was for us to perform sperm banking. And he arranged for me to go and do that right before I started chemo.
He made sure that he answered every question of my husband and myself, and said, do you understand what's going to happen here? And he spent all the time in the world on that very first visit answering any questions, and a lot of them were above our heads that we didn't understand, but he answered any questions that we had as far as what to expect from there on out.
He took time to spend time with Joanne and I to go over what our situation was, what we're going to do, kind of gave me the game plan, which is what I really wanted at that time, because yeah, we were still frightened. Now we're really frightened. The doctor explained things. This is what the treatment you're going to go through. We're going to try this treatment.
You want the results if they're good, but if they're bad, you want the doctor to explain what the next steps are.
You can't over-explain what's getting ready to happen to them, because I think people need to hear it. You're kind of in a little lost world when you're in there listening to this for the first time. Your mind may hear about half of what's being said.
For the longest time, I didn't know what was wrong with me. And to hear somebody like so sure of themselves and how to treat me and how to, the options that I had and everything, that was very, very uplifting. You want to make them feel like you understand because you've seen him before. That was really always helpful for me, knowing that my doctor has seen this before and he knows what to do.
I just felt like I was in the best hands because she was doing everything possible to make sure that I was treated for my condition.
Just knowing somebody that was like confident about what I had, about how to treat it, and it was amazing. It was like, gave me so much confidence.
His confidence in himself just really overflowed to me, that he knew what he was talking about, he knew what he could do, and that he knew this was very, very treatable. And I knew every day I walked in there that I was going to be walking out. And as the commercial says, a life to be continued.
We're grateful to these 4 patients for sharing their experiences. We hope this video helps to illustrate how paying attention to how we communicate can benefit patients and families as they deal with the crisis of cancer.